Welcome back to the Ricky Matthews Show from the Citizens Bank Studio. I really enjoyed that conversation with Paige Roberts. And as we kind of transition into Singing River Health Talk, which is the second half of every Wednesday show, I'm reminded as we had that conversation about Hope Squads and the work that Jackson County has done to focus on the alarming teen suicide rate, that the work that the Singing River Health System Foundation has done, and partnering with Jackson County Chamber and Paige Roberts and the school systems, et cetera, to bring Hope Squads to the community. It's really terrific. And that's what leadership in the community is all about. So anyways, we shift gears now and move to Singing River Health Talk. I'm thrilled to be joined today with Dr. Johnny Sanabria-Lopez. And he's a neurologist, and he specializes in headache and facial pain. He grew up in Puerto Rico, but he came through Keesler. Here's another physician that has that Keesler experience, and I look forward to introducing him to you. We got a chance to talk a little bit before the show started, and I'm very impressed. So, Dr. Sanabria-Lopez, how are you doing, my friend?
Yeah, doing all right. Grateful to be here today. Appreciate that.
Yeah, it's good. It's really good to see you. Hey, listen, we'll get into specifically about your specialty, and we'll really kind of dive into that pretty deeply. But when you talk to people about what it is you do, how do you talk about it?
Well, basically, I will describe myself as a neurologist with a headache and facial pain subspecialty. So overall, I see all kinds of neurologic conditions, but I have a special focus on headache and facial pain. Most commonly migraines, obviously, which is the highest disabling headache condition of all kinds of headaches. So, yeah, if that answers your question.
So you grew up in Puerto Rico?
Yeah, that's correct.
And did you know you wanted to be a doctor, growing up, or is that something that came, that evolved along the way?
Yeah, ever since I was a little kid, my grandfather and aunt, they were doctors, so they kind of inspired that influence on me to be a doctor moving forward. So when I grew up, yeah.
So you went to school in Puerto Rico. You actually did your residency in Puerto Rico, but then eventually you came to the University of South Florida. Tell us a little bit more about that.
So once I finished my 4 years of neurology training in Puerto Rico, I joined the Air Force midway between my second and third year of residency. And then thankfully, the Air Force granted me permission to do my fellowship year, which is 1 year training. Most neurology subspecialties, headaches, epilepsy, and movement disorders, all of them are 1 year training. So I couldn't just go there and do it because at that time, well, I belong to the Air Force, so kind of I had to get their permission, like a whole separate process. But thankfully, they granted me that good to go. And then I was able to go to South Florida, do my fellowship there for 1 year. And then once I finished there, I just joined the Air Force in 2022 until present.
Yeah, well, interesting. So you spent your time in Keesler. What it's so interesting, because I say it often that people who come through Keesler Air Force Base, a lot of them decide to retire here. And many of them, not all in the medical field, of course, but many in the medical field decide to have their careers here. What is it that you experienced while you were at Keesler that made you decide that you wanted just to stay in the community?
Well, there's an increasingly headache population here in the Gulf Coast, both Florida and here in Mississippi. For some reason, my best thought will be the constant fluctuation of barometric pressure with all the unexpected weather changes and all that. So I saw an opportunity myself to be able to help a lot of people, provide them with the best possible quality of life. And that's why I decided to stay in the area.
Yeah. Well, listen, I have friends, family members who have all experienced chronic migraine scenarios. I had one early in my career. I had one bout with a migraine, so I really can understand what it is. It was extremely debilitating. Thank goodness I never had any issues after that. But I've seen what it looks like when people have to deal with that, and to have a doctor that specializes in that. I'm sure that you probably see a bunch of patients, as you pointed out. There's maybe a higher degree of headaches here, but it can really be debilitating for someone, can it?
Yeah, definitely. Absolutely. So there's nothing more rewarding than treating a patient having 30 days of headaches out of 30 days of the month for many consecutive years. And then over time, you see that improvement, you see that progress. That patient starts having better quality of life. He's able to go participate of outdoor activities. He's able to attend their grandkids' graduation, you name it. So there's nothing more rewarding than that for me. So that's why I decided to pursue that specific subspecialty career.
So as a neurologist, I'm sure that one of the first things that patients who come to see you are concerned about is that something else isn't going on. You're probably very focused initially on ruling out anything bad, so that you could then focus on, and there are several intervention therapies that you're engaged in. We'll talk about that here in just a second, but they're probably relieved when even though it's debilitating, that it's not something more severe.
Yeah, normally when I see a patient for the first time, we kind of check all the boxes. I try to address every single concern that the patient may have. We conduct all the indicated appropriate workup. And then once we exclude everything else, then we're just left with the migraines, and we just try to be as aggressive as we can treating them, and then ultimately the patient gets to decide how aggressive or how far they want to get in order to improve.
Yeah. So, facial nerve pain. I think about. I had a friend of mine who had a really serious case of Bell's palsy, and my granddaughter did as well when she was really young, and she recovered from it, thank goodness. But is there pain typically associated with something like that?
Yeah. Facial pain is a broad spectrum kind of pain. It can be associated with basically anything. It can be related to the migraines. It can be an isolated problem. It can be a solely nerve pain problem. So yeah, absolutely.
So when you think about when a patient should see you, and you're advising, because I'm sure there are a lot of people who are listening to this now who have had bouts of headaches that they're concerned about. What's your advice to a patient when they should, go ahead and come on in and see you?
That's a great question. To be honest, there's not like a black or white answer for that. I will say once the pain, including facial, neck, head pain, starts impacting functionality, starts impacting quality of life, that's when you should come see me.
Yeah, if you're losing sleep, it's impacting your work. If
Yeah.
it's you're limiting your daily activities because you can't do it. That the severe headaches enough. You just can't ignore it. I guess they should. But it's interesting. People will tend to wait. A lot of people just wait, and it's kind of sad, really, when you think about it. And the number of doctors that I've talked to know that there are some really good things that you can put in place pretty rapidly that can give people some relief. Your advice to them would be, don't wait.
Yeah. Patient education is actually one of the most essential components of that first visit. We have to set up expectations, realistic expectations on how the treatment is going to work over time. Got to be patient, get to wait a few months depending on what treatment we decide to pursue. Some patients are fast responders. It's important to mention, I don't only see adults, I see a fair number of pediatric patients. I have 10-year-old kids that I do Botox injections on. I have 13-year-old kids that I do Botox injections. And like I said, it's so highly rewarding. See them being able to go to school, missing fewer days of school. So yeah, I
Yeah, it's really interesting. I have a sister-in-law who has a neurological condition, and I don't know how regularly, every couple of months or maybe once a quarter, she gets Botox injections. But really, it's given her incredible quality of life. And I mean, when you think about what's happening with Botox, with nerve blocks, with trigger point, we'll come back to that after we come back from the break. But the advancements in technology have really guided you, and the relief that's available for patients today is pretty significant, isn't it?
Yeah, absolutely. There are multiple combination therapies that can be combined with the Botox as well, and they have this additive effect. So they synergistically work. I will say they're kind of the dynamic duo. That's how I describe it to patients.
Yeah, we'll talk about that when we get back on the other side when we continue our conversation with Dr. Johnny Sanabria-Lopez. We'll see you after this. Welcome back to the Ricky Matthews Show from the Citizens Bank studio. We're visiting with Dr. Johnny Sanabria-Lopez, who is a board-certified neurologist who specializes in headache and facial pain. And he's had a terrific background, originally from Puerto Rico, did some training there, and then, of course, at the University of South Florida, and then at Keesler. He did some work at Keesler and then ultimately landed at the Singing River Health System. And, when we went to break, we were talking about what's available to patients and how technology is kind of moving. But, technology really is changing rapidly in your world, isn't it?
Yeah, that's correct. The mainstay of chronic migraines is Botox injections, nerve blocks, trigger points for neck pain or what we call neck-related headaches. We also have infusions. We also have monthly injections. So in terms of effectiveness, I will say most of them are equally effective by themselves. It's just patient preference, right? Ultimately, they get to decide. Like I said earlier, if I want to pursue a more aggressive approach, that's when I start combination therapy, and that has given me such great results.
And
for my patients.
What does it feel like? I can tell that you're well. First of all, you're referring to a more personalized approach. You really, to be a good neurologist, you almost have to be a psychologist too. You want to be able to coach the patient to help them understand their situation and so on. And then when you define what your intervention is going to be to help them, to see a patient that's really, some of them are in agony when they get to you, and to see them respond to the treatment and just, start to glow again. I bet you love that, to see that in your patients.
Yeah, definitely. That's the most rewarding thing about my profession is just see those patients get better. Like I said, getting better quality of life, being able to participate of activities and things that they were not able to do before because they spend the whole day laying on bed. So that's what I strive for. That's what I for. And
hey,
I'm
listen,
to be in that.
My son, Justin, who works in New York City for Price Waterhouse, he's on the international consulting team. He spent some time in Madrid after he graduated from Auburn University because he wanted to become bilingual. And on the international consulting team, he actually most recently went back to Madrid for a meeting at Price Waterhouse. And obviously, his Spanish has come in very handy for him. And he loved, incidentally, absorbing himself in the Spanish culture, but his bilingual nature has really helped him greatly in what he's doing. It helps you too, doesn't it?
Yeah, absolutely. Especially here in the Gulf Coast with the increasingly diverse community that we have. So yeah, I can basically use being an asset in that aspect and being able to communicate in both English and Spanish. So that way, those patients that may have a language barrier, I can be able to help them, and that's also something that's very rewarding as well.
How often do you draw on that? Is it pretty regularly? How often do you? How often do you deal with patients who speak Spanish, for example?
So back in Florida, the Hispanic population was way higher than it is here. But like I said, here I've seen in 3 years, I've seen an increase, a growing diversity
Yeah.
community. So yeah,
Yeah.
I could say if I had to guess a number, probably roughly 20-30% of the patients are Spanish speaker.
Yeah. So
Here in the
you
Gulf
said
Coast.
your grandfather, is that what you said? Your grandfather was a doctor and your
Yeah,
aunt? Yes.
yeah.
So were they also mentors? It's interesting. You chose neurology and you seem to have such a patient-centered approach. Is that something that came from your family, or is it something the mentorship of your grandfather and aunt gave you? Where did that come from?
So both my aunt and my grandfather, they were in the surgery field. I wasn't that interested in pursuing a surgery career. So my interest in neurology started with one of my, I would say, a mentor that I had in med school who was a neurologist. He was a very smart guy, uh, such a great personality. He was able to help a lot of people. And I think that kind of inspired me to pursue neurology, which is, I mean, the brain is something that not everyone feel comfortable with in the medical community. So I saw that as an opportunity to be a great asset and provide and ensure great care from a neurology standpoint.
Yeah, yeah, it's notable, and I can tell it. For people who are watching on SuperTalk TV, you can see it in his face, and of course on YouTube or Facebook, however you're watching the show. And if you're listening on the radio or on your favorite podcast platform, just know that he's a guy you can tell he's quite passionate. Got a young face, so I bet when people see you, they think, "Oh, you're younger than I expected you to
Yeah,
be." Do they say that a lot?
yeah, yeah, that's correct. Especially in the military, which I have to be clean shave all the time.
Yes, for sure. Listen, doctor, it's been a pleasure to spend some time with you, my friend.
Same here. Same here. I thank you for the opportunity to be here on this show and just provide my testimony, provide my story, and yeah, looking forward to
Yeah,
help a lot
it's
of
been,
people.
yeah. Congratulations to you, and hope you have a great career. This has been Dr. Johnny Sanabria. Excuse me,
Gabriel
a
Lopez.
trip at the end. Lopez. Have a great day. We'll see you next week.